Welcome to Don't Give Up on Testicular Cancer, a podcast where testicular cancer survivors, caregivers, and others who have navigated the cancer journey share their stories. The podcast comes to you from the Max Mallory Foundation, a nonprofit family foundation focused on educating about testicular cancer in honor and in memory of Max Mallory, who died in 2016 at the young age of 22 from testicular cancer. Had he survived, Max wanted to help young adults with cancer. This podcast helps meet that goal. Here now is your host, Joy Slotstrom, Max's mom and a young adult cancer survivor.
With me today is Dr. Jason B. Carter. He's a urologist, and he's been providing his outstanding care since 2003. His medical degree is from East Tennessee University, and he completed a residency at the University Hospital and Clinics in Columbia, Missouri, which we've already discussed as my alma mater, so I always like to mention that. He opened his private practice in Greenville, Tennessee in 2006. And he's a board-certified urologist by the American Board of Urology. He's also a member of the American Urological Association and the Tennessee Medical Association. So welcome, Dr. Carter. Thanks so much for being here.
Yeah, it's a pleasure.
So why don't you just start out and tell us a little bit about your practice, your career as a urologist, and then we can get into more about testicular cancer.
Well, I'm originally from Tennessee. I went to University of Tennessee, Knoxville for college. I went to East Tennessee State University for medical school, so both in the East Tennessee area, and then branched out to Missouri, the University of Missouri-Columbia for my residency. And, I decided just to go into general urology practice. My wife had supported me through medical school and residency. And when I mentioned doing a fellowship, she said, it's time for you to go get a job. So basically, my first job was in Greenwood, South Carolina. I was there for 3 years. And then we moved back home to East Tennessee, and we have been in Greenville, Tennessee, a small town in East Tennessee, for the last 20 years. So I've been in private practice for 23 years, practiced general urology. Unfortunately, what we're seeing in the urology field is really an impending shortage of urologists, especially in rural areas. So I think my area would be categorized as rural. For instance, in my town, in my county, I'm the only urologist. So that affords me an opportunity to see a lot of patients. And as a general urologist, have my hand in a lot of diverse urologic problems and conditions, and then, treat those with assistance from my oncology colleagues, and then refer to tertiary care centers when we need to do that. And fortunately, in Knoxville, we have a large university hospital that we can, ask for assistance. And we have Vanderbilt in Nashville, which is an excellent institution. And, when you need that highly specialized care, we can get our patients down to one of those two institutions.
I think that's good to know for listeners who might be in your area, because I know a lot of times people don't know where to go for care for just a urology issue, but then testicular cancer. So it sounds like you have great options for care for anyone that might need that for testicular or any situation.
And, too, living in a rural area, we're probably socioeconomically, my patients can be limited with transportation, finance, ability to take time off from work. And I think a good place to start, especially with something like a testicular lump or lesion, is just your local general urologist. A lot of the initial workup we can do, initial procedure can be chin out for something specialized. I always tell my patients, let's get you to a higher facility to get some specialized care, that come back to me and let me do the routine follow-up.
Yeah.
It saves patients a lot of time driving and that kind of thing. So, we always, tell our patients, go get what you need to get done. if we don't offer that, but always come back and let us help as much as we can.
Yeah. And that's a good advice, I think, for all of us. Can you talk a little bit about what you've seen over the years with testicular cancer patients? And I guess one question I have for you, and that I've heard from some of the men I've talked to, is just how they don't know often to check for a lump. And then they see it and then they're surprised. I think that's a piece of advice that's important to understand.
Well, I think, of course, it's very important. I think that, women probably do a much better job, educating themselves about what they should be doing for their health. I think in some regards, women's health is probably addressed much better than men's health. I mean, women's very early getting, pelvic exams, pap smears, mammograms. So they get introduced into the system quite early. A lot of times the first time a male patient is going to see a doctor, that would typically be maybe when they're 30 or 40 years old. Her wife convinces them that it's time to go get a checkup.
Yeah, I know.
And, I'm a little bit different. I mean, of course, being in the medical field, I was given a lot of knowledge early on in my life. Yeah, I'm not sure that we really tell men that they should be doing a male breast exam. Male breast cancer is pretty rare, but also they should be doing a testicular self-exam. And, really the primary age group for testicular cancer is young men. I think usually I will tell a patient that 20 to 40 years old is the primary age group. And all those men, monthly at least, should be doing a testicular self-exam. And I'm not sure that we tell men like that, like we're supposed to. It's probably not mentioned by, the doctors and then, within families, a lot of times those type of issues aren't really talked about or addressed. So, a lot of times if a man comes in, and especially if they have felt a little something that worries them in the testicular or scrotal area, it might be the first time they're seeing a doctor.
Yep, I know that's very true. And I just think what you said about knowing to do the exam is important, and being able to say that to a man, to make sure you do this every month and that type of thing. And the more doctors like you can help us with that, I mean, hopefully it'll change.
Well,
Go ahead. Go ahead.
say that there are good and bad things about the internet.
Yeah.
Hopefully, I always encourage my patients to do some self-education if that comes up. I don't think all the information is bad. I think you can certainly kind of sometimes go down a rabbit hole and get more confused than educated. But I think that is one nice thing about the internet is, before if a man felt a lump or something on the testicle, a lot of times there's embarrassment, there may be anxiety, fear, and sometimes people's reaction is to ignore the problem. But I think a lot of men now go on and Google, hey, a lump on the testicle. And they can read a little bit about that, maybe feel a little bit more comfortable or confident about seeking out an exam and maybe not be quite as anxious or quite as likely to ignore that. It's just a thought, pre-internet age, you were just kind of a person who felt something, but at least now men have a resource that they can go to and at least kind of get the ball rolling on getting a problem checked out in that regard.
Yeah, I think you're right. And I also think on just when I think about when I look for health information for myself, I try to think about the source of, who's saying this about whatever it is I'm looking up. It's a medical professional that's giving me advice versus whoever. I don't know. So I think that's important. But I want to know too, just in terms of being under the care of a urologist, I mean, what's your advice for patients beyond testicular cancer? But, when do you go see a urologist if you're a guy? Is that an annual visit you should have as one of the specialists in your care, or any thoughts on that?
One problem with healthcare is it has become so fragmented. There's a specialist for everything. You can say doctors most of the time, see sick people. Maybe the healthy people don't go to the doctor as much, but I think a lot of our family physicians can be quite overwhelmed at how unhealthy the patients are that they're seeing. Between obesity and metabolic syndrome and diabetes and high blood pressure and all those sorts of things. You would hope that the primary care provider can address questions that might come up about low testosterone, erectile dysfunction, urinary problems. But a lot of times I think we're busy, quite frankly, maybe overwhelmed, don't have the time or the knowledge base, because knowledge in all medical fields is advancing so rapidly. It can be difficult for me times with what's going on. So in one regard, hopefully, if you're having an issue, your primary care provider might be a good place to start. But quite honestly, I also have a huge interest in hormonal therapy. I'm only one person, so I can only see so many patients. But I would just really encourage any male or female who is having a hormonal related issue, having a urinary issue, having an erection issue, a fertility issue. And there's nothing wrong with seeking out a urologist as the first person that you see to address those issues, because a lot of times that's what we're focused on, what we're going to talk about, and we have the knowledge. I've never required referrals to come to my practice. I've always allowed people to make their own appointment and come in. We're seeing younger and younger patients for a variety of issues, low T, infertility, erectile dysfunction. But a lot of that speaks to just, I think, how generally unhealthy we are. And when I say unhealthy, that includes stress, poor sleep hygiene, poor diet, and a lot of these things contribute to, issues that will affect people and the urologist can address. So I would encourage patients who have any kind of issue to seek out a urologist very early on. Maybe that urologist will, have an interest, hormonal. Yeah, the hormones, not, a lot of people don't have a huge interest in that in the medical field. You really have to seek out a hormone type clinic. But I've tried to incorporate that into my medical practice because I just see a huge need for it. And then especially for testicular cancer patients, once they go through treatment, that is something that definitely needs to be addressed very early on, because it can have a huge impact in, how patients feel and how they perform.
And that's good to know. We haven't talked a lot about the hormonal side of it on the podcast. And I know it's important, especially I think of some men I've talked to have lost both testicles. And so then they really need to focus on the hormones. And I also wanted to talk, you mentioned some of the other side effects, testicular cancer. So you work with Aeroflow. I'd like you to just tell us about that and how that's can help testicular cancer patients.
Well, I mean, for testicular cancer patients, I think for the treatment of testicular cancer patients, it should not really lead to urinary issues, right? So I think, especially in early stage, now when you have later stage patients who may need chemotherapy, who may need radiation therapy, and certainly patients who may need a procedure called a retroperitoneal lymph node dissection that involves trying to clean out lymph nodes that are really can be intimately involved with the nervous system. Those are patients that tend to have some degree of urinary dysfunction or urinary side effects. And it can be, things like frequency, urgency of urination, loss of control, not only sort of urge incontinence, but also stress incontinence, and then rarely a condition called detrusor sphincter dysynergia. So where the bladder and the urinary sphincter aren't communicating properly. So some of those can be nerve side effects with the RPLND procedure. Some can be sort of neuropathy created with the chemotherapy, the fibrosis of the bladder or irritation of the bladder from the radiation. Fortunately, I think, to some degree, some of the chemotherapy and radiation related side effects can be more short term and maybe managed with physical therapy or kind of simple medication. But, if patients, have a injury to the sympathetic nervous system with, a lymph node dissection, those things can be take a little bit longer to resolve or require a little bit more effort of kind of working with the patients and trying to get them better.
Wow, that's a lot, but it's good to understand that
Yeah.
hey, what the symptom, not the symptoms, but the side effects are, and then B, like you said, some of it is short term, and then others could be more involved depending on the kind of treatment that you've had. So,
just the physical therapy component of it. A lot of times that's an additional expense for the patient. It can be a transportation, time off work achieve. And I really encourage a lot of my patients to think about the physical therapy, and have a non-medicine type route to getting better because, sometimes it's really easy to put patients on medications and you can have side effects with those as well. But, the physical therapy is very important, but also, the newer medications that we have much fewer side effects than some of the older. So there's a lot of medical options and there are procedural based options for the incontinence. And then, of course, if you need temporary help with, guards, pads, briefs, that type of thing, a company like Airflow is really great to work with. We work with them pretty much exclusively in my office for our catheter supplies and incontinence supplies, and really have never had an issue. They've been a great company and a great team to work with, and they make my job a lot easier because we just have a little iPad and we put in what we need, and the patients get what they need, and it's a really smooth process.
well, and that's good to know because I think often patients don't know where to go if they need those kinds of supplies, and it's like, do I just go to the grocery store and buy them or what? And the more specialized products and design, like you're describing, I mean, I think that's a really important just piece of this that sometimes gets lost, I think, in the discussion. So I thank you for sharing that because I think it's important.
No problem.
So I guess as you think about what's ahead with testicular cancer, I mean, I know you don't know, but in terms of, I guess, advice you might give to some of your patients or young men listening and to help either maybe stay on top of it if you find something or just, any guidance that you might have for our listeners.
Yeah, I want to say certainly, being sort of a more rural general urologist, right? You know, number one, testicular cancer in a typical urology practice is not an overly common thing, right?
Okay.
And I would say number one, like every man should be doing a testicular self-exam once a month. Even if you feel like your testicles are maybe you don't feel a lump or a bump, if they're on the small side, right? That might be a reason to come in, discuss fertility, discuss testosterone related issues. The testicles may not be functioning, optimally. Certainly, if you feel a lump, a bump, a nodule, something down there, we certainly want you to come in and get that checked. But fortunately, most of the time when men come in, it is not a testicular cancer. It might be a fluid collection around the testicle called a hydrocele. It could be a cyst on the testicle or the epididymis, an epididymal cyst, a spermatocele. It could be a little calcification around the testicle called a scrotal pearl. So most of the time these are very common benign findings, and a simple exam will oftentimes, really say, hey, listen, this is not a cancer. This is a benign finding. This is kind of normal. And you get a chance to explain the anatomy of the testicle to the patient, which a lot of people don't really understand. We keep charts and diagrams in the exam rooms. But certainly, I think a lot of men may ignore those things. Maybe it's anxiety, maybe it's fear, maybe it's a lack of insurance. Because even for patients who have insurance, a huge issue is the copays, the deductibles, the out-of-pocket expenses are getting higher and higher every year. And you may see a relatively young person who has a $7, $8, $9, $10,000 deductible, and just to come to the doctor's office is essentially they're paying for that full visit in cash. Certainly I always encourage patients, you really have to put the financial part aside and make sure you take care of yourself and your health. Because certainly if you are one of those patients that comes in and you do have a worrisome lesion or nodule, and we confirm with ultrasound that is suspicious for testicular cancer, if we can just do the procedure, remove the testicle, do the orchiectomy, a lot of times that's all you need, right? Part of that workup, we do an exam, we confirm with ultrasound, we get appropriate tumor markers, we do a CT, make sure we stage the patient accurately. And, I just saw a patient the other day, had a really large, abnormal testis, did the tumor markers, and he had put that off for a while, right? He was
Yeah.
self
Yeah.
had no insurance. But, even in cases where you're worried that this could be more advanced, he had a seminoma, which is a favorable, pathology. It was stage 1. It was confined. We did his procedure, and we will just have him on an active surveillance protocol. So, it's just so unfortunate when men put those things off, because if we catch the early stage 1, we do the procedure, and for the vast majority of patients at that stage, that's all they're ever going to need. Of course, we do follow up post-operatively and, for several years after. But yeah, I've just encouraged patients, just come in and get it checked. We try to make the patients feel very comfortable. We try to teach them the anatomy, answer all their questions and reassure them. But then if we are worried, we get the appropriate workup done and get them taken care of. And that can take care of it. I would encourage you, if you feel anything down there, just come in and see a urologist. It's a really easy visit for me, because a lot of times I just reassure people and everybody's happy. And if we catch it early, we can get it fixed, and patients do well.
And you're right, because I think the point there of catching it early is so important, because it does make a huge difference. And like you said, often that's all you take care of it and remove it, and surveillance, and if something else happens, well, you deal with it then. But at least you got it that first step. So that's
Yeah.
great advice. So is there anything you want to mention that I probably maybe didn't bring up, or you want to share about your work?
I would say that one thing, have a real interest in male and both female hormone therapy. We have a large testosterone replacement therapy component in our practice. And I try to encourage as many women as we can to consider hormone replacement therapy when appropriate, but especially for testicular cancer patients, not only when patients come in for the initial consultation, if we are more concerned, or a lot of times patients may come in with an ultrasound with a true abnormal finding. One part of my workup, in addition to tumor markers, is also total and free testosterone. We want patients to know where their testosterone levels are preoperatively. If we do an orchiectomy, they are going to be losing a testicle. Now, again, with one testicle, especially younger patients, they have very, high fertility rates. Most of the time, they do not have clinically significant low testosterone when they're young. They can still father children, but we like to have a baseline. Post orchiectomy, we'll check testosterone, compare what were our pre and post-op numbers, and just have that as a reference guide. And then at that point, if the patient's not symptomatic, we encourage them, hey, maybe your numbers are in the lower end of the range, but if you have a healthy libido, you have good erections, you have a good energy level, there's no reason to start therapy. But when patients do mention, well, hey, I seem to have more brain fog, I don't have as much energy, I'm not as interested in sex, my erections maybe aren't quite as good, maybe I'm gaining some belly fat that I didn't have before, then we can always look back at those numbers and treat them, when they are clinically symptomatic, and we feel like that's important. So I think when you think about the testicular cancer patient, a lot of times we think about the diagnosis, the treatment, and then the surveillance. But we need to make sure that we address hormonal issues. We need to ask, hey, how's your flow? Make sure there are no issues there. How are you feeling about your diagnosis? For a lot of patients with any type of cancer, you see the doctor, you get your scan results, everything looks good. We'll see you in 6 months. And then for 5 months, you're okay. And then that month leading up to it, a lot of anxiety, kind of worry, is my skin going to look good? So just making sure that, they feel comfortable with how things are going, and you address any anxiety or concerns that they have, and discuss fertility, just a lot of issues. But I think just making sure that you address the hormonal component of it, make sure you address the urinary kind of function or control portion of it, but then also the fertility portion of it. Certainly for our young men who have not had children, making sure that we mention cryopreserving sperm preoperatively, so that they have a chance to father children naturally, very important. And then also just, addressing fertility concerns that they might have postoperatively.
That's wonderful. That's a lot of detail and great advice for men to know about. So I appreciate that. You may have to come back and talk some more about some of these different items. It'd be great. So So my last, what? Go ahead.
Well, too, and of course, I think it's important to understand that, when you have a diagnosis like testicular cancer, to some degree, the urologist may be the quarterback in the beginning. Of course, I'm very fortunate to have an excellent radiation oncologist that I work with, and very fortunate to have a couple of very, very good medical oncologists that I work with. So, it's definitely anytime you have any kind of cancer, including testicular cancer, it is always a team approach. And I think testicular cancer is one where, the urologist is going to be the one you meet, get the initial procedures done, do the post-op follow-up. You may be meeting a radiation oncologist. So every urologist needs a good one of those. You may need a medical oncologist. Every urologist needs a good one of those. So I'm fortunate, even though I'm in a small town, that we have an excellent oncology team. So I feel very confident when I need assistance from those, doctors, that my patients are getting very good care.
That's great. Yeah. So my last question is, what song, when you hear it, do you have to sing along?
Well, I saw that question, and I would probably have to say any Morgan Wallen song. So
Okay. I
we're
don't
up
know
here.
Morgan. Tell me about Morgan Wallen. I don't know him or her.
So he's country music, and I just kind of, like him and enjoy his music. He's a singer-songwriter. I think he writes a lot of his own music. He's from East Tennessee. So, in his songs, he talks a lot about Tennessee and, football and, growing up in East Tennessee and the balls. So, just I think sometimes you just find artists that you like and kind of speak to you. So to me, anytime Morgan Wallen's on, I'm singing and my wife and daughter are rolling their eyes. That
Okay.
and not carry a tune, I promise you.
Oh, I'm with you on that. My fourth grade teacher told me to fake it when I was singing, so it was so bad. It's true, but that's a longer story. But anyway, okay. Well, I really appreciate your time, and I hope you will come back and just tell us more.
Oh yeah, anytime, just give me an invitation. I'm glad to talk to you.
Okay. All right. Well, thank you.
Bye-bye.
Thank you for watching this episode of Don't Give Up on Testicular Cancer. If you enjoyed this podcast, please subscribe to our program on your favorite podcast directory. You can also visit the Max Mallory Foundation at www.maxmalloryfoundation.com/podcast to listen to previous podcast episodes or donate to the foundation. Join us again next time for another episode of Don't Give Up on Testicular Cancer.